And that nurse no longer works here at the VA, but according to federal prosecutors, she also resigned from a different job due to issues related to narcotics. Kathleen Naftel hiding her face as she left federal court this afternoon. The 55-year-old is charged with one count of obtaining a controlled substance by misrepresentation and one count of tampering with a consumer product. She's accused of diverting morphine intended for at least one hospice patient at the Bedford VA in 2017. Federal investigators credit another employee with the initial discovery. Naftel's accused of diluting morphine, giving the patient less medication than prescribed. She then, quote, ingested a diluted amount of the remaining drug. Investigators allege that, quote, due to diluted morphine administered by Naftel, one veteran experienced increased difficulty breathing and increased suffering in his final days. Fellow employees discovered red caps and syringes with morphine. These are photos of some of them. After initially denying all allegations, Naftel later admitted to investigators that she had addiction problems and had been diverting drugs for at least 2 months. Federal investigators also discovered Naftel resigned from Tewksbury Hospital instead of facing disciplinary action related to, quote, her failure to follow appropriate procedures when wasting narcotics on 60 occasions. And by wasting, investigators mean disposing of. And we have reached out to the Department of Health for comment on Naftel's time at Tewksbury Hospital. We're waiting to hear back. Naftel faces up to 14 years in prison if convicted. She's due back in court next month.